for the session. So good evening, everyone. Good afternoon, good morning, depending on where you're joining up from. It's always a pleasure to have you in our daily lightning sessions. And this is the 15th session, and we are the 20th, this Thursday, the 20th of August, 2020. So special good evening to you, Sohini from New Delhi in India. And hi, Mercy Onu Peters from Nigeria. Great to have you with us, Ike Timothy. I'll be glad to know where you're joining us from. And just to remind you, gentle reminder that as you're typing in your messages, please ensure that you're typing the message to all panelists and attendees so that everyone in the room will be able to get your message. Okay, Ike Timothy, you're joining us from Abuja, Nigeria. And we have a Q&A icon, just reminding you also, if you have any questions, you click on that icon and you ask your question. It's not for comments, please, and it's not for greetings, it's for questions. It's the Q&A segment. So if you have any questions, do well to type it there. Greetings to you, Patricia from Madagascar. Great to have you with us in this session. All right, so where are we? We are in week 2. That is, during this week, you are called upon to submit the initial version of your project. And I'm sure yesterday evening and today, some of you received a mail inviting, for those who are not yet joined peer grade, inviting you to join peer grade. So if you are here and you have not yet, please, I'd like to encourage you to join the platform peer grade. That's the platform in which you're going to submit your project. Even if you have not yet completed your project, please join peer grade so that tomorrow when you finish up, or at any time when you finish up with your project, you will submit it directly on peer grade. So what should be in your project? Before we move ahead, I just want to ask you, if you are here and you are having difficulties with the project, whether it be technical or difficulties with the content, with understanding the rubric, please, you could raise your hand or type in your difficulty in the chat. Raise your hand and it'll be a pleasure for me to invite you to unmute yourself and to share your difficulty with us. Francois is here for that. Shalini is here for that. I myself, we are all here to give you the support that you need so that you'll be able to meet the deadline for project submission, which is tomorrow. So welcome to you, Obed Philip Nyobe, that's connecting from Agona Kwanta in Ghana. And hi, Usman Tijani from Nigeria. Always a pleasure to have you. So if there is no hand raised and no difficulties highlighted in the comment section, I'm just going to remind you what the content of your project. There is a priority challenge. There is a specific goals. There are concise actions, and you are to cite the sources that you use to develop your project. So right now, I'm going to invite Dr. Francois Gaz to run through the template that was provided for you on Learning.Foundation, the Word version, in which you are supposed to write down your project and submit it. So over to you, Francois. We're just going to run through, you're just going to run through to clearly define, that is, explain to you how you should fill in this template. This is like a step-by-step guide from Francois. Good evening, Francois, and how are you today?
Good evening, I'm okay. It's not late evening here. It's nice and cool weather. So good evening to everyone on this session, and happy to hear your experience. And let me first maybe recenter the project to be sure we are all on tune with what is expected from the project. So you have a template to fill, and the template has some guidance in what's called the rubric, where it gives you more detail on what is expected to be in your project. First things I would like to remind that we are not here writing a thesis. We expect that whatever you write is a 2, maximum 3 pager. So you have to be brief, concise, to the point. We don't need long and multiple sentence. We need brief, concise sentence, very clear. Now, when you fill, we need you see the template, which is on the screen. We need your country. We don't need your name. We need to find, if you work in the country, you may be your country is a country of origin, but where you work is a country where you're based and you work, because there are some consultants sometimes that work in a different country than their own country land. Now, it will be very important to put yourself, as you see in next horizontal line, to put at which level of the health system you work. Could be at national, could be a regional, district, or health facility. It's important because your role and responsibility change. And when you're at national level, you design policies, you design strategy, and you try to get those strategy and policy implemented. And when you're at health center level, you are implemented actions to try to get where you want to be based on your challenge. Now, let me go to part one first and look at what you expected to do in part one. As Charlotte has mentioned, and there was 5 bullets, I know, we all know you face many challenges with immunization due to the context of COVID, which have led to problem of dropout, problem of coverage going down, women not coming to session because they heard on one way you should stay home, and then they say, but you should still go to the health facility to get your children immunized. Then there's some fears to be contaminated. There is sometimes false rumors coming along, which even challenge them more to get out of the house. Sometimes the logistics is a problem, so they cannot walk 2 hours to go to immunization sites. So basically, among all those challenges, we expect in the project to choose one. It doesn't mean the other challenges are not addressed by your micro plan, your national plan, your EPI, your continuity plan, but wherever you are, we would like you to choose one priority challenge and justify why you choose that challenge, which means you try to see that challenge in the context of the other challenge you're facing, and you choose this one because if this one is resolved, you believe that you will have contributed in a major way to increase your coverage, reduce your dropout rate, etc. So choose a specific challenge. The challenge specific could be very low down. It could be attacking, controlling false rumors, for example. This is a decent challenge to achieve. Your challenge could be to convince a community that it is safe to get to the health center and important to get your children immunized because the risk is even for vaccine preventable disease higher than COVID. Now, when you're this challenge, justify the challenge versus the other challenge, and then look at the cause of the challenge, because analyzing the main cause will help you to choose the appropriate action to target the challenge and contribute to its resolution, even if it's not 100%. Then when you have defined your challenge, and you have to be very specific, it has to be understood very precisely, you should then you should put your challenge above, the challenge that you see in the horizontal column before your level of health system is a summary of some important aspects. So this is where what Charlotte is showing you is where you put the challenge after you fill the part one. You have now a specific challenge justified. And then after you have a challenge, you need to set a goal. Try to set a specific goal which is directly linked to your challenge. It's not the overall goal, which is coverage, restoring coverage to the level of pre-COVID. It's a specific challenge you want to achieve that will contribute to the overall challenge, which is improving coverage or reducing dropout. So you set a specific goal. Then the part two, and in the meantime, make sure in your justification, you show some evidence of the challenge. And it could be evidence which is in your information system. It could be evidence you have collected through observation, or few studies done at community level, or report from health facility that have reflect what the interview of women has shown at village community level, etc. Now, part two is just responding to your challenge. It means responding with corrective actions. You may decide to take 3 or 4 corrective actions that will be complementary to address your challenge, but they have to be totally relevant to the challenge you address. Don't talk about the other challenge. It has to be, the actions have to reflect corrective measures to resolve, to overcome your challenge. And as an example, you know, someone say in one, we have false rumors, rampant false rumors that are spread through the social network. Your specific action could be to control your challenge, become controlling every rumor coming up is detected and is reacted upon to stop the rumor. It means that your goal is to see the number of rumors going down and every rumor addressed in the right time. Now, if you look at actions, maybe you're going to do what someone suggested in the past, a cartography of rumors. And it's a timely cartography. And you say you want to know, each time there is a rumor at the district level, you are immediately informed and you take action to stop it. So now, when to implement such a cartography, you may need a certain number of details. You need to define how you're going to get the information on rumors, how you're going to, and who is going to react to the rumors. How do you train people on how to react on rumors? And you see, the detailed activities that will be linked to a special action you put in place have to help the action to occur. You need a cartography that's useful, detect, and you know where are the rumors. So it could be an example that you will establish a call between the health center or between the district and communities, and you ask communities, asking communities to call a special number to report a rumor and define the rumor. You could define who is going to react to the rumors and what training they get to make sure that when they go for the rumors, they know how to address it. So in the details that's written here, you should use action verb. Why action verb? Because it's easier to monitor what action you have to take, other action being taken. At the end, you would like all the critical actions to be taken for the action to work. Now, don't go too far. I think you should prioritize again. As much as you need to prioritize about action, and we say 3 is great, 4 if you can afford. And in the task for each action, make sure you select the 3 or 4. If you have a long list of 10 or 12 tasks, you may never be able to make it. You will have not the time. So it's important to prioritize, which means what we mean by prioritization is to make sure that this task is very important and will help the action to take place. Some are detailed tasks. You may, a very minor task will not help much, are useful, but not that much. So make a priority. Now, the next, the next section of the rubric is for you to cite, to tell what the ideas you had in the specific action, where do they come from? Do they come from the idea engine? Is it your idea? Was it suggested by your micro plan and just implementing it and you may have started? So we would like you to list the title of the idea you found in idea engine with a number and the name of the author. But you may also have other source. It could be the global guidelines of WHO. It could be your COVID response plan. It could be the district manager, if you're a health center, we decide to do something and you're helping to implement it with the idea which is suggested to you, or it's your own idea. Now, we would like to be sure that whatever you do in this project, it is integrated in the overall plan of action of your district, your health center, or your national plan. We want to avoid you to have your own project on the side of all what's going on. We know you have a lot of work. We know that you are asked to do much more than just your project. So your project is just a focus on one activity among the many activities that you want to make work and make a difference, if it's not all the difference, on the challenge you address. So not a separate project, not an academic project, but a project that you're going to implement and you think it's feasible, it's credible. You don't need thousands of resources that you don't have because it takes time to mobilize a lot of resources, but some are there. Minimal resources may be found out locally. So make sure that your ideas are really doable, feasible, and time-wise, they don't take years to be implemented. Thank you, and over to you, Charlotte. Happy to clarify if there's more questions on how you feel the template.
All right, so thank you very much. Thank you very much, Francois, for detailedly explaining step by step with so much clarity how scholars are supposed to fill out this template to have a project that is feasible and that is complete and helpful, could be helpful for potential reviewers. While you were talking, I indicated in the chat that if you have any difficulties or questions, you could share them. You could type them out on the chat or raise your hand so that Francois could address them. So far, there is no reaction. So I'm just going to say welcome to Angela Kisoso that joined us from Nairobi, Joseph Gugi from Kenya, Muranga, Kifle from Ethiopia, Ada Kanin from Kenya, and Hassan from Kenya. Welcome, Yahaya. That says, thanks so much for the update. You're welcome, Yahaya. And so we have Glory Oduoji from Nigeria, and Rita Anaba has just joined and has not indicated where she's joining from. So right now I have a question to ask you if there are no hands raised as yet. If you have already submitted your project, can you type a yes in the chat? If you've already submitted your project, can you type a yes in the chat? And if you have not yet, can you type no in the chat? We want to do a rapid kind of like, okay. So Hini says no, there's yes from Infinix. Rita says no. So please just go ahead and let's do this rapid poll. I'm sure Shalini is there to take notes of the poll for me, and thanks for doing that, Shalini. All right. That's great. So now my next question is, if you have not submitted your project, it is because you are facing a difficulty with one of the platforms or there is a misunderstanding as far as the project is concerned. Please, can you raise your hand? There is a hand button on your screen. I would like you to raise your hand. Not necessarily for you to share your problem, but just another quick poll. So if you have not yet submitted your project because you are facing a difficulty, either with the platform that is peer grade, learning.foundation, or with the content, with an understanding of the rubric, please, can you just raise your hand? Okay, yes, I'm seeing one hand raised. And I see Rita has written on the, my challenge is on part 1. I'm still confused. That's good to know. So I'm going, Bashir Sabo, I'm going to invite you to unmute yourself. If it's possible for you to talk, can you just tell us what the problem is? And you can also type in your difficulty or your challenge in the on the chat, and like Rita Anaba has done. And please make sure it is addressed to all panelists and attendees. Thank you. So Bashi Sabo, I don't know if you are in the possibility to, you have the possibility to unmute yourself. Good evening, Bashi.
Good evening, Ma. How are you?
I'm fine, thank you. And you?
Yes, I'm fine too.
All right. So where are you calling from?
I'm calling from Nigeria.
Okay, great to have you. So what is your challenge, please?
Yes, my challenge is the rubric. I don't know how to get the rubric so I can start my projects.
Okay, so your challenge is where to get the rubric. Are you talking about the rubric or the template?
The rubric, Ma.
Okay, you've been able to download this template?
No, I haven't downloaded it.
Yeah, because this is the template that you have to fill. The rubric okay. is the guidance, is the guiding document. It's a PDF version. and then the template is the Word version that you download from learning.foundation. So what you do, Bashi, I'm just inviting you, can you type in your WhatsApp number in the chat, and either Shalini or myself, we are going to contact you after this session and help you.
Okay, thank you very much.
Okay? All
Yes,
right,
ma'am.
so
Thank you very
just
much.
type in your WhatsApp number in the chat. So thank you. I'm seeing there is also Adefunke Adesina. And if you're also having a problem with the email, please, you can also raise your hand if your problem is the email address or password. So we're going to be able to see how we can support you with that. So the next hand raised, Adefunke Adesina, that's a regular attendee in these sessions. Good evening to you, Adefunke. Hello, Adefunke. Unfortunately, we cannot get you. I hope we do. We will be able to get you before the end of the session. So I'm going to allow, there is Arif Amadullah. Arif Amadullah. Adefuke, just hold on. We do hope the connection. Yes. Good evening, Arif. Oh, it's afternoon.
Good evening. This is Dr. Arif from Afghanistan, and I'm happy to participating in Fair Hub. I would like to mention that I have access to the template and downloaded the template, and I'm going to work on my project. My challenge is implementation during the COVID-19 pandemic, and that will be my purpose to write about the situation of the current polio situation in Afghanistan, especially in the southern region, which has a high transmission. And I would like to set a challenge, and after that I would like to have a specific goal, and I will focus on it and how to achieve and how to reach the missed children, cover them.
Okay, so Arif, if I may ask you, what is your priority challenge? What is that challenge that you're facing in immunization because of COVID-19?
Yeah, just as I mentioned before, my challenge is about delay of polio campaigns implementation during the COVID-19 pandemic.
Okay.
Before the time we had the campaigns regarding the polio eradication, but unfortunately during the COVID-19 we missed the campaigns, and we didn't implemented any campaign in the southern region. So currently the transmission is going on, and we would like to start the campaigns against the polio, about the to eradicate the polio. And just also we developed an SOP and how to implement the, and just how to reach the missed children and stop the transmission.
Okay, and what is your, for your project, what will be your specific goal? Forgive me if I'm repeating
Just
this
my
question. Unfortunately, your
Hello?
internet connection. Yeah. Hello.
Hello.
Yes,
Arif,
we are
you
getting you. Arif, we can hear you. Please continue.
Yeah, just my my specific challenge will be delay in the polio campaign implementations. As I mentioned, still we didn't implemented any campaign, and the missed children percentage has become high.
Okay, so
Okay,
Francois.
yes, Arif, thank you very much. We need a bit more clarity. I understand you have delayed your polio campaign because of COVID. Now, have you get a fixed date now to do a campaign, or it is still delayed again? So for the time being, your problem is how we can get soon a campaign because transmission is going on, or is it implementing a quality campaign in spite of the impact of COVID on the participation of mothers with their children? what is your exact problem linked to COVID?
Yeah,
Can you be
just
more specific?
yeah, just as I mentioned before, during the month of September, we want to implement the first campaign during the pandemic situation, and we also developed an SOP how to conduct the trainings and how to deal with the community during the pandemic situation. And our focus will be on protecting our vaccinators' safety. They will be use the masks, sanitizers, and also one thing will be different from the before. We will not have the evening meetings, and also we will do some flexibilities during the trainings, and also we would like to how to deal with the community.
Okay, so I think I understand. So for you, you're not going to implement a campaign as usual, but you're going to face some restriction and constraints because of COVID. And what is your challenge is to be sure that you're going to achieve high coverage in spite of COVID. But now, among all the challenge you face, you said you're going to equip your workers with masks, and there is also all the measure to prevent contamination. What is the main one that you feel that you need to address as one project that will help you to do better in coverage? That it means women would come to the session and get immunized. What is it for you? What's the main obstacle you will have to overcome to get better coverage at your campaign, which will not be undertaken like the previous campaign? Do you have an idea or not yet?
Unfortunately, Francois, I think the internet connection has let Arif down because I can't see him in the room anymore. And we know that part of his presentation was lost to us because of issues of internet connection. So right now I see Adefunke. So I just hope that Arif will be able to join us later on. So Adefunke, please go ahead. I hope your internet connection will permit you to speak now. Hello, we can get you, but the volume of your microphone is very low. We still are not able to get you. And the good thing is I see Arif has been able to join again. So Adefunke, please, can you go ahead?
Good afternoon.
Good afternoon.
Please, can you hear me? Can you hear me now?
Yes, we can.
Sorry. Thank you so much for your for your passion in making us to arrive at our goal in achieving our project done. I would like to ask, aside this particular template displayed on the screen, is there any other thing expected to be filled as part of the project? I know we have part 1 and part 2. Is this template consist all, so that I know, because I've already finished all my own with this template alone, using the rubric as my guidance. I just wanted to know that, hope I'm not missing anything aside this template. Is there any other thing we are filling aside this template? Thank you.
No, there is no other thing you're filling. If you fill this template, it means that you are up to date with your project.
Thank you. Thank you. I just want to.
All right. So can you permit that I ask you some questions concerning your project?
Yes.
Are you connecting with your phone or with your computer?
I'm connecting with my phone, talking to you, but I opened my project on my computer.
All right. So you can tell us a little bit about your project.
Okay. Yeah.
Yeah. So what's your priority challenge?
My priority challenge, my personal challenge is the decrease in immunization demand rates resulted from fear of caregivers bringing their child or their wards for immunization in the mix of COVID-19 outbreak.
Okay.
Yeah.
So can you justify why that choice?
Hello?
Yes.
Yes, okay, I should justify why I chose that
Yeah.
aside all others. Yeah. And because so far from what we used to, I'm the monitoring and evaluation focal person for Lagos State at the
Okay.
Directorate of Planning Research and Statistics. It is saddled this responsibility of checking, follow up with our data, and to have an evaluation on some of our programs being done at the end of the day is saddled to my desk. Now, we check from time to time through DIH, we use DIHS, the data, that is Data Health Information System 2, the reviewed one, to check from time to time. Most of the time we do it quarterly, first quarter, second quarter. The one we add, so that at the end of the day, we always like to evaluate most of our programs. Most of the programs that maternal and child health is one of the essential key programs that we always like to evaluate from time to time. And immunization is one of the key of this essential maternal and child program. The one we add through our DHIS data in the month of January to February, the DHS data revealed to us that there is a shortage, there is a decrease in the immunization demand by the caregivers in Lagos State. And so the integrated supportive supervision that we do quarterly from time to time also reveal the same thing, that there are decrease in the demand for immunization compared to those ones we've been having so far. And we could see that there's a slight difference between the one we had for the second quarter, between the months of April and June, seems to be a little high. There's increase in the dropout rate of some of the antigens like polio, like measles. Then other one compared to what we have been having before in the past.
Okay,
Hello?
so yes, we're getting you. So what's your specific goal?
My specific goal is to do our specific goal is the sensitization on the health safety in the mix of COVID-19 outbreak among immunization stakeholders in the 20 local governments and 35 local council development area in Lagos. We have altogether 35 local governments and 35 LCDAs based on our senatorial district in Lagos State.
All right, so can you tell us about your action steps?
Thank you. The first of all, when we identify this, and there's an assessment that we add, there's this device that we use, supported by the JICA, I mean Japan, one of our partners, Japan International Cooperative. We call it the photo tracking system. This is a device that we use. There's a central dashboard at the PSC board, likewise the Lagos State. We used to track down all our defaulters, especially those mothers that were not able to complete their antigen for their children. From this track system, we observed that there are a lot of drop rates from specific antigen, especially polio and measles. This was, concluded in our reports. We had a report written for this and presented to the top management people. And for the fact that we assess the risk as well, we quickly take an action on what to do. And part of what we found out from our assessment is that the health worker themselves, the health worker also, they are panicked. They are not even sure of the PPE they are doing and PPE they use. So we discovered that PPE to the health workers themselves is more of psychological rather than the evidence-based reason for using it. Then another thing that we found out is that mothers were panicked, according to the spot check that we had, that mothers were also panicked to come to the health facility because they believe that they can be contaminated. Also, there are some nurses and other health workers that used to have a rapport aside the normal official relationship. They have their personal rapport with some of these clients. So they use this medium to remind them of their subsequent antigen for their children to come for. But we discovered that based on the, the social distance and the likes, people were not too relating with themselves. So some of these mothers and in fact, the health workers, they lack confidence. They didn't want any touch with anybody, despite the fact that some of them use PPE. So one of our action thing is, the first thing is to sensitize our people, especially the immunization stakeholders. Who are they? The top management people that are involved in immunization, and then the CSO, the community people. And there is this program we usually have quarterly in at the state level, which is, we call it state consultative meeting, that involve all the stakeholders from different sectors in health. We discuss this, and we also cascade this thing down to those people we call community health people. We call them the community health officers. These are the people picked from the community. They ask a bias, they ask what we call a concern for children, especially when it comes to their health. So we discuss with them, we sensitize them, and we organize some of the consultative meeting, some via visual, some that we know that may be due to the data, or they may not have an access to data. We organize based on words to discuss with them. We sensitize them. We let them realize what government has in place when these mothers bring their children to the hospital to the health facility for immunization, and why it's important to do so. Likewise, we sensitize them on what they needed to do on their own personal safety towards this in this mix of COVID-19. That is not only the health facility they can beat COVID, even if they may going out among themselves, they can as well quit. So we generalize our safety health precautions by organizing the IPC, what we call infection prevention control training for the health worker. Likewise, the community people, especially the World Health Chairman and its members, and we sensitize them. From this, we try to do a follow-up with them, whether these children, the mothers are be duly informed. We ask them to go to their different works to help us explain all this to the mother, that government has in place what can keep them safe whenever they come to the hospital. Then we ensure that the government also supply all the necessary things that can keep the health worker safe, likewise the mothers or caregivers that brings their children to the hospital. Then the next thing is we try to check. Dash to see. Are you there?
No, yes, we lost you for a while, Adefunde.
Okay. Hello?
Yes, go ahead, we hear you.
Okay.
Yes, we can hear you. Charlotte?
Okay. Then another thing that we do, another specific action that we do is that we try to, get all the materials needed so that when these mothers come to the hospital, they will be able to be reassured that they are being protected, and our nurses, our healthcare workers also were reassured. And by using this, all the personal protective equipment, they tend to have more confidence in themselves, that mere having a contact with these mothers or the external caregivers does not necessarily mean they can contact COVID-19. Then we follow up with our dashboards and see what is happening. Then we also try to check we do a supportive supervision. We continue our supportive supervision by checking on the health workers and the mothers, and to be sure that we this supervision, when I say supportive supervision, is not to catch anybody to see what they are doing, but what we meant is to follow up with them and to assist them on whatever anything we think is challenge to them. Then there's a review meeting, that's 3 days review meeting to hear from the health workers, likewise the community health people on the community health ward, we call them ward chairman, World Health Chairman, WCH. So we check on them regularly to know how far and what are the other challenges that government that is feasible to provide for the mothers so that they can start bringing their children for the antigen needed. Then we follow up with our defaulter tracking device so that we can quickly pick whoever that is not coming for the antigen to come for their specific antigen. And at the end of the day, we're realizing that the drop rate is decreasing instead of moving up as it was before. It starts changing and people start coming for their antigen. Thank you. Is there any other thing you want to ask me? Hello?
Hello.
Hello, yeah.
Yeah. Charlotte?
Hello, yes, I'm with you.
Okay. Maybe as Charlotte may have lost the connection. Thank you, Adefumbe, for presenting a very comprehensive plan. My question is that the plan you present, is it a plan you have already at state level? Because how big is Lagos State?
Yes,
30,
thank you.
40 million, how many million people live in Lagos State? You have 15
Thank you so much.
LGAs?
Presently, we have, according to the last DHIS data, from our Lagos State Bureau of Statistics, our population is like 26 million now. Hello?
Yeah.
Yes.
Yeah,
Yes.
I heard you.
Lagos State, yes.
I think that's important. And your position is at Lagos State level. It's usually it's at the state level. Hmm?
Is at the state level, yes. I'm about to say that it's at the state level.
Can you explain to me if this plan of action was developed, has
Yes.
already been developed, as you see the result, it's developed. Now, in
Yes.
this action, which is very comprehensive, what are the challenge? You know, you've seen the trend going down, and you are at the state level, which means you're not at community level. What are the main challenge to get your plan into action? Where do you find a challenge? All your activities looks very good, all the action, but is there some still challenge existing? Can you specify one of the challenge in implementing the plan that has been developed at the state level?
Yeah, but don't forget that it's part of those things. It's only because you asked me what I put as my challenge. The first one I told you, which is the main one, decrease in the immunization demand rate resulted from fear of caregivers bringing their children for immunization. The second one is increase in the dropout rate, which are
Let me stop you. We understood. It was very clear. My problem is within within these two problems you have specified, which one is the most important, and what is the most important cause of the problem in the one you select as a priority?
The most important cause is the fear of both the caregivers, likewise
that's very important. This is going along what we aim the project to be, is not to address everything. We know everybody is addressing all the elements as you do, and you do. I heard your word follow-up, and I love the word follow-up, and I'm glad you mentioned it many times, because that's the way to find if all your actions are taking place and leading to the result you expect. Now, if the fears, how do you address really in practice? What are the three actions you have taken to address the fear, and how can you make sure that they are implemented effectively? What are the steps? Can you, it's like making a focus on one thing. Hmm?
Thank you so much. Like I've mentioned earlier, that we actually sensitize, we add a lot of sensitization verbally, we had on the media, on the social medias, on the television, on the radio. So then we actually sensitize the community. When I say World Health members, we call them World Health chairmen. These are people that are living in the community, because at the state level, we organize all the, I mentioned consultative forum that the government usually have every quarter that involve all the stakeholders. These are we communicated, we established a strong relationship between these community people who will be having relationship with their husband, their friends, who also have the children among them that is giving birth, who also has wife among them that will have a friend that will communicate with another friend. So we try to follow up with the World Health chairman, and we strengthen our supportive supervision to cut across all the LGA so that we know what we're doing at a point in time. We try to do this so that we can sustain it, because it is something that we find in our annual action plan that is it are collaborated with what we have as at the national level, likewise that cascaded to the state level.
In your action that you're implementing, you describe, what is the most completed one, which could be a bit frustrating that they don't work as well as possible, but you think that this is a critical action that has to take place with various action steps as you describe? Which one, from your level of working, which one can you act on where you feel that it is not working as well as you dream to make it work?
Well, by providing, because most of these community people expected that all these IPC material will be provided for them. Governments cannot distribute hand sanitizer across everybody. Governments cannot provide sink for everybody to start washing their hands, but we only let them know what they can improvise to do this. So we found out that people still find it difficult to do a strict social distance among themselves. For the fact that, there is this particular means of vaccination in this COVID thing at the early stage of COVID outbreak concerning this conspiracy theory. Some of them still believe that there's no COVID.
Okay, so I think you are touching, you are touching, and if we base the exact objective of this project, I think the project is really to focus on one particular, not the overall challenges that you have, and you have described very well, but looking at one area of the challenge where you just described, which is very important, it's become a priority. You still face problems to make it work, and you're going to take actions to make it work. And that would be extremely, relevant to the project you have. So go down to the challenge you face in some of the area you have planned for, but it is not leading to your expectation. And you're going to develop some actions from your level in how you're going to make those actions work in practice in the field with better results. You just described the challenge of this social distancing, some of the beliefs which are not there about that we don't have polio or whatever, there's no COVID. I think work on those things, that will be very useful in the context of the challenge we hope the scholar will write. Don't go for the overall challenge, focus on one and go down and fill the place on, I could say, a sub-challenge in a way. Okay, am I clear?
Right. Yeah, yes, thank you.
All right, so thank you very much, Adefunke, and thanks to you, to Francois. I just have one last question for you, Adefunke. Have you already joined a peer grade?
Yes, I've joined, but I'm yet to submit my assignment and my project. But I've
excellent.
Already joined.
Okay, so I do hope that the feedback you have received from Francois is going to be useful to you as you finalize and submit your project.
Yeah, thank you. Yes, very, very much.
All right.
And my last point, you are very detailed, and I love that. So the more focused you are, I'm sure you will find a very, very illustrative example of what we're trying with this project, all the participants to work on. And, you know, we don't need, if it's an area very difficult, just start, do the best you can. It doesn't need to be perfect, but work. Obviously, you're a very experienced person. I've enjoyed to listen to all the details of your various strategy, and they're impressive. Now we want you to go a little bit more and focus on one area that you find very difficult to work on, you have described. And next week, you know, there would be an opportunity to build up with peer comments to make a very decent project at the end of next week. So move ahead, and I'm sure in 1 week time you will have a very nice project. Good luck.
Thank you. Thank you. Thank you.
Thank you once again, Adefunke. I saw the raised hand of Umar Naji. I'll invite you to unmute yourself, Umar. And I just hope that Rita Anaba, you said your challenge is on part 1. So I do hope that with Adefunke's presentation and with the feedback from Dr. Francois Gaz, you have been helped. If that is not the case, you can either raise your hand or really type in specifically your problem, your difficulty in the chat so that can be addressed directly. All right, so, and we have been also going through the others who have been posting their problems in the chat. We are going through your messages on the chat. So do not worry, we are seeing how we can address those. So Umar Nazir, if you are getting me and you're in the possibility of unmuting yourself, please go ahead.
Hello.
Yes.
Hello.
Hello.
Hello, good evening, Umar.
Good evening, everybody there. I will. Hello. Hello.
Yes, we can get you. Yes, we are getting you.
I'm trying. I had some personal problems previously. That's why I couldn't submit my project due to my personal reasons. My father-in-law is admitted in a hospital right now, so that was the reason why I couldn't make it to my project. But as Shalini has just sent me a link, I will work on it. And my challenge, I have already put my framed my project about the difficulties I am facing while conducting the immunization sessions at all the primary care hospitals in the state. So what I have suggested and I have discussed previously also with you people, that what I have done innovative in these things, that before we are starting our immunization session at our hospitals, we screen our healthcare workers before entering to the immunization session. Okay, and after screening from the by the infrared thermometer, if they are febrile, if their temperature is less than 100, we allow them to go to immunization session. And after wearing proper PPEs and following the SOPs as laid by the Ministry of Health and Family Welfare by the government of India, they follow the SOPs, and we start conducting the immunization session of the children. But simultaneously, when the children come, under 5 children and their mothers come for immunization, they are also proceed the same procedure before entering the immunization session. So they are also screened. For the fever, and the ILS symptoms are asked by our healthcare workers. After that, if they are found negative on that, we allow the children to go for immunization. So so far we have been very successful in conducting all the immunization sections. Our dropout rates are not so high, because the parents are very keen, so they don't miss their children immunization in this pandemic also, because of the proactive health education given by our community health officers previously. But simultaneously, we face the everyday challenge of this COVID-19, because the cases are coming increasing day by day. Previously, in the month of March, we used to have 1 or 2 cases or 3 cases of COVID per day. Now we are getting, in our state, in our division also, per day we are getting 500, 700 cases per day, and including each area or each street, we are having 5 to 10 cases per day. So it's a big challenge how to continue our immunization in this pandemic, especially the COVID-19, which we are now facing. But still, we're trying our hard. Our healthcare workers are very hard. They're working very hard under such circumstances, but they have a major concern of their own health. That's priority for them. So they must not contract this. But as so far from the last 4 5 months since March, I can say that around 6 months, we don't have any healthcare worker who's working in immunization has contracted a disease because of the following the SOP. And simultaneously, we have not found any children yet who has entered our immunization or getting contracted by the same disease. So I will try to submit my project tomorrow. How we can come to overcome all these challenges we are facing by the COVID-19, because COVID-19 it's a long journey and it will take time to come over it, and the challenges are many, especially in the under 5 children, because we cannot let our guards down in the under 5 children and especially in the pregnant ladies. So I'm trying to be connected with you, and hopefully by tomorrow I will try to submit my project on the challenge we are facing here in view of the COVID-19. Thank you.
Thank you.
Thank you very much, Umar Nazi, and we are really sorry to hear about the personal problems you're going through, and we do hope everything is well soon. And really congratulations for what you have shared and for taking upon yourself to work on your project and submit it tomorrow. We are, it's almost 4 minutes to 7 p.m. Geneva time, so I'm just going to call on Francois to, give his feedback directly concerning the presentation you have made.
I would have submitted my project today only, but unfortunately my father-in-law got admitted 5 days back. He had a pneumonia but non-COVID, so he's still in ICU here. That's why I couldn't make myself a project. So I will try to get through it, and hopefully I will submit my project tomorrow. That's why I will be working day night. Today it's right now we have 10:30 here evening in India. So I will try my best to finish it today, and by tomorrow I will submit the project to you, inshallah.
All right. So we wish him a quick recovery. Yes, Francois.
Yes, I also I hope that your father, I'm glad it's not COVID, and I hope he gets out of the hospital quickly and healthy as ever. Sorry to hear that sad story. I totally understand, and I'm sorry to see that the challenge is getting bigger and bigger. You getting from few cases to 500 positive case in your state, in your division. I was really impressed by your process to protect your health worker, and with a success story. And I think it's something that's nice to be shared. But I was saying, he has no problem, he has no challenge, he's successful. So I'm not sure what he's going to write, because he has no challenge. He has already put a solution, he has put action in place, he has a process, and he has a good results. No health worker has been contaminated since. So obviously you have put in place a fantastic approach with actions, with SOPs, and a kind of algorithm to make sure that you have no problem. I would really congratulate you for having done that. Now, it's nice to share your approach to all the participants, because they may learn from your successful approach. At the same time, I was wondering, but what is his challenge now? What are you going to write in your project that you're not happy with and you wish you do better? It came to my mind that given the increased number of COVID, maybe there will be so many cases that mothers may start being worried. Is this a challenge, having more and more 500, more and more COVID? Are you going to face a shortage of staff because they will be busy with COVID case, vaccinators, or how do you see your challenge ahead that you need to address with this project by anticipation? Could you comment on that?
So Umar, if you can unmute yourself and comment on, yes, please go ahead.
Yeah, I'm feeling a challenge right now because due to the increased number of COVID positive cases in our division, which caters a population of 70 lakh people. So every day the cases are rising, and healthcare workers are now contracting the disease. And every hospital we have, in every PSC, primary health centers, we have 1, 2, or 3 cases of healthcare workers getting contracted by the COVID-19, and it's a huge challenge to simultaneously conduct the immunization sessions. Initially, we had. Advisory by the government of India initially, that we must not conduct the immunization sections and stop in the containment zones where we had cluster of cases of COVID-19. But I talked to my senior officer, or I can say that my HOD, head of department of the community medicine. I talked to him on the previous occasion. I told them we can't let our guards down in under fire children. If we let our guards down, we can have diphtherias, we can have measles, we can have rubella, we can have all the outbreaks. So let's keep aside with the guidelines of the ministry. And and with the consent of my HOD, started immunization in such against the advisory of the government. But after few weeks, after 2 weeks, the government put the advice that we must not halt the immunizations in the under 5 children. So luckily, but I didn't. I went against the advisory initially. But this was a big challenge to go against the government advisory and put immunization in place in these the difficult circumstances. But only ray of hope what I had was that I followed the SOPs by means of that the healthcare worker, he will go to the immunization, but not without screening, and he will follow all the SOPs in means of protective peer, personal protective equipment, and the children, all the children who were coming to the immunization, and they were also screened for temperature, fever, and ILI. And after that, we used to do the immunization sessions. But by the grace of Almighty, till now in my hospital, I don't have any healthcare worker getting contracted by the disease. And I myself was in the clinic of the ARI, ILI. I took this challenge myself, that I had seen from March 15th up to this August is going on. I had put a separate ARI clinic in my hospital in place, so that every ARI clinic ARI patient comes directly to me, and I, by the grace of Almighty, with following my SOPs laid down by the WHO, Government of India, as well as Ministry of Health, I have seen more than 3,000, 4,000 ARI patients till now in my OPD since the COVID-19. And by the grace of Almighty, I have not contracted a disease. I had done my PCR twice. I had done my antibodies for IgG also, but unfortunately, because I had not contracted the disease yet, my IgG were not titers were negative for antibodies. So this is a huge challenge to work in such a circumstance where the COVID cases are increasing, and simultaneously you want that you don't miss any child who must be left out. And simultaneously we have some migrative population which are coming from rural hilly areas. They are migrating from one division to other division. They are nomads, and they are also coming summers to in our division. They have also been immunized by my team, and we went to these far-flung areas and did the job.
So thank you very much.
Thank you.
Yeah. A quick feedback, Umar. I think you are very clear on what you do, and it's really remarkable. I congratulate you for all what you do.
Thank you.
As you know, you don't get a vaccine that can be infected at home or in his own community and not automatically in the hospital with the patient. And you're doing preventive measures that at least they don't get contaminated in the hospital. At least this is preventable. I would sort of recommend that your challenge is to maintain your success in spite of a growing problem of COVID, and look for actions that will help you to maintain the success you are sharing in terms of maintaining immunization, protecting. This is your real challenge because you already succeeded with all what you have done in place. Now, your challenge, if I hear you well, is to maintain your success story. So what are you going to do when so many COVID cases are occurring? You're already starting saying you separated the ARI, you did something. Try to think of what are the actions you're going to do, additional actions that will help you to cope with the increased number of COVID that could affect your immunization services. That would be very useful for a lot of people as well when they read, given the level of detail when you make a strategy, you put in strategy in place could be very useful and very adequate for that project. But of course, it's a challenge to write on how to maintain what I've done well as they're making my life more complex. Thank you.
All right, so thank you very much, Francois, and thanks to you, Umar Nazi. It's 5 minutes past 7 p.m. Geneva time, and we really do apologize for going over the time that it was assigned. I thought we were going to hit the ceiling of 1 hour, but we have gone 6 minutes over. We do apologize for that. So just a gentle reminder that tomorrow is the last day for the submission of your project. That is, we have just a little over 24 hours to submit, and that the time limit is 11:59 p.m. Geneva time. And you can still attend the technical support session tomorrow with Alain Blaise if you're having any issues at 11 a.m. Geneva time. And you can join us tomorrow, Francois Chalini and myself, at 6 p.m. Geneva time for some final tips. But just to let you know, to assure you, you don't need a perfect project just now. Even if you have just a draft, even if you have not yet finished, you can still submit it before 11:59 p.m. Geneva time tomorrow. And next week, during peer reviews, your peers will review your work and will give you useful advice, counsel on how to improve upon it. So week after next, in week 4, you will have the time and the chance to revise and to improve upon your project before submitting the final version. So that said, I just want to wish you the best for those who are still working, and don't forget to reach out to us if you are in need of support. So looking forward to seeing you tomorrow evening. Stay safe. Nice evening, nice afternoon to you, depending on where you're joining from, and bye for now.
And thank you, Charlotte, and thank you for the presenters to have shared great experience, and especially a successful challenge for Umar that we can learn a lot from. Thank you.
Thank you, everyone. Okay, see you tomorrow. Bye.
Bye, Shalini. Good evening. Good night. Short, but good.
Good night, Francois. Good night, Shalini.